Okay, good afternoon, everyone. Thank you again for joining our webinar today. We're going to get started very soon. We just want to give all of the folks that registered for today's webinar just a minute or so to log in. So while we're doing that, if you don't mind, go ahead and give yourself a shout out in the chat box. Let us know who you are, where you're representing, if you're representing an organization, an agency, or if you're logging in from any particular city or state, or even country. We've had some people internationally who have joined our webinar this week. So let us know. And we'll get started in about 2 minutes. Thank you, everyone, for livening up the chat box. Right before we get started, if folks can just confirm that they can hear my voice clearly and they can also see the screen clearly. Great, great. Thank you so much for confirming that. We will get started in about 1 minute. We just want to give all of our registrants some time to get logged in. All right, we'll go ahead and get started. Good afternoon, everyone. And thank you so very much for joining our final webinar titled Centering Black Mamas to Live and Thrive in Practice, as presented by members of the Black Mamas Matter Alliance for our 3rd annual Black Maternal Health Week campaign. My name is Angela Doing-Sala-Aina, and I'm the current interim director of the Black Mamas Matter Alliance. And so before we get started, I would like to cover some logistical items. Everyone is currently muted and will stay muted during today's webinar. We will have time at the end for questions through the chat box, so feel free to submit any questions that arise throughout this webinar, and we will try our best to address them after the presentation. Please note that all webinars presented this week will be recorded and available for viewing on our website. I want to take a moment to express our deep gratitude to all of our sponsors for this year's Black Maternal Health Week campaign. We'd like to give a special recognition to our Changemaker level sponsors, the United Way of Greater Atlanta and Merck for Mothers, and our Movement Builder level sponsors, City Match, Every Mother Counts, Vintner's Daughters, and the American College of Obstetricians and Gynecologists. Your investment in this campaign continues to help us make a significant impact. So a little bit about us. The Black Mamas Matter Alliance is a national network of Black women-led organizations and multidisciplinary professionals that work across the full spectrum of maternal and reproductive health. We operate at the national, state, and local levels, and we collaborate to advance policy, promote holistic maternity care, cultivate research, and uplift culture to advance Black maternal health rooted in the birth justice, reproductive justice, and the human rights framework. Of particular note, we use the phrase Black mamas to include a range of folks, from women and birthing people across the African diaspora to those who care for and mother our families and our communities, whether they have themselves given birth or not. Founded by the Black Mamas Matter Alliance, the National Black Maternal Health Week campaign intentionally takes place in April, which is recognized in the United States as National Minority Health Month. Additionally, we begin Black Maternal Health Week on April 11th annually to join dozens of global organizations and advocates in marking this day as International Day for Maternal Health and Rights, an opportunity to advocate for the elimination of maternal mortality globally. For BMMA, we recognize maternal mortality as a global crisis affecting women across the world, not just in the US, and we join other Black and African women leaders across the diaspora in the fight to end maternal mortality. The purpose of Black Maternal Health Week is to deepen the national conversation about Black maternal health so that public stakeholders understand how rooted causes like structural racism and gender oppression act as drivers of maternal health disparities. This year's theme is Centering Black Mamas, the Right to Live and Thrive. Centering Black mamas and their right to live and thrive highlights the need for health practitioners to listen to Black women and invest in Black women in their care and service provision. This is especially important now that we have better data that provides further evidence that the lack of quality of care and disregard for Black women's humanity is deadly. By centering community-driven solutions, we can help Black women, their children, and their families to thrive. Starting off today's webinar is Kay Matthews. Kay is the founder of the Shades of Blue Project. Kay has a background in early childhood development and mental health and is a licensed community health worker. Along with writing her first bestseller, a self-help journal, Kay is actively teaching and speaking to women of all ages to help them to better understand how important it is to advocate for themselves before, during, and after childbirth, especially as it pertains to maternal mental health. To Kay, this is the most important aspect of the work she does within the community, and it is the motivation that she uses to continue to educate communities worldwide. Welcome, Kay.
Thank you, Angela. Thank you, BMMA, for having me on as a speaker. Welcome everyone that has joined us for this webinar as well. I am truly grateful to be a part of this organization, as BMMA truly sees and understands why maternal mental health should be a conversation, a part of the conversation when we're talking about maternal health. So for so long, I've been saying, when we think about a checklist of 1 to 10, mental health should be at the very top before that list starts. So I appreciate the opportunity to present first today. So one of the things, a part of our mission, our current mission at the Shades of Blue Project, It's shifted, so we break down what Black maternal mental health looks like for us. So we've broken it down into 3 parts. So acknowledgement, respect, and support. Like without those 3 things, we're staggering, right? Our main goal is to address the cultural barriers that currently exist in the maternal mental health space. Next slide. Right now, 1 in 4 women of color experience maternal mental health complications. What I'm about to read is a statement from the World Health Organization. It says that pregnant and postpartum women experiencing severe forms of mental disorders may commit suicide. Perinatal mood disorders, including postpartum depression, can affect any woman, yet women of color often face life circumstances that increase their likelihood of experiencing perinatal mood disorder. When I read this statement, I get stuck on that last little part that says life circumstances. How do we break that down? What exactly does that look like? So when we talk about life circumstances, we talk about living conditions, we talk about income, we talk about employment, education, the effects of the lack of these things, poverty, a non-healthier lifestyle, all of this. But when we listing these things out, the one thing we leave out is racism. So life circumstances can happen to any of us, right? They affect us in so many different ways. But the one part of the conversation we don't address is racism, because racism will block the type of care that we need, even more so when we talk about the mental health part of this. Next slide. So let's talk. Like today, I am genuinely, if you know me or you will get to know me, you will know that I'm a person who feels like the way we get through things is we get through things by talking. So let's talk about some of the current barriers that happen to women in the postpartum period. Next slide. So these are the top barriers that present during the postpartum period. These are statements that we have taken from the women over time that we have assisted. A lot of what you'll see is the bolder ones that says, 1, my doctor doesn't listen to me. What will my family say? One that always comes up is, the last time I asked for help, I thought they would take my baby away from me. Now that's a huge one, y'all. Like seriously, this statement happens so often, and when women are going back for like their checkups, or even it actually can start to form in the provider's care before they give birth, right? I've examined this and talked about this with many different women. They may have sort of been struggling during the pregnancy and didn't say anything, and then of course continuing to struggle after the pregnancy and not feeling comfortable with their provider with addressing these the things that they're feeling. So not just that, it's one of those things is, I thought my maternity care was done. So when you get in this mindset that you feel uncomfortable going to where you are, you don't feel like you're listening to, you're being listened to, you have these babies and we just go on. But it's about the lack of real true care that we receive that will actually delay us from getting what we need in that postpartum period. So I'm gonna keep talking so you can really look through this slide and see what women are actually really saying and why that it is important. If there are providers on here, community health workers like myself, all of us should be looking at these things. And how we should be looking at them from the lens of maybe asking someone that we know who's had a baby or previously or now or going to have a baby, asking them like, how do they feel? What does postpartum care look like for them? Like, what has been their experience thus far? Going to the doctor, like all of these things will play a factor on what their maternal health will look like after they give birth. Certainly during, but certainly after, in the postpartum period, what that would look like. So take a little bit of time to really look at this slide and know that this is coming from, this is what real women are actually saying. That one that says, I feel fine now, I put that in parentheses because it's now. So if a woman comes to us within 2 weeks, 2 or 3 weeks after giving birth, that now is important to address later. I feel fine now. Well, if she doesn't come back to us to receive any more services or resources, the later part of when she may come in, like a month or two later, may actually be too late. So when we have someone who presents and says, I feel fine now, we make notes to check on that person later, because now is not the factor, it's the later. So it's the down the line. So being able to pick up on these things, I am telling you now that we present complications in the postpartum period. It's just about, are our providers actually catching it? How comfortable are you making us feel enough to address what is happening during this time? Next slide. So I put this in a sense of the old way and the new way. One of the questions I always ask is, what are some of the ways you are currently right now addressing maternal mental health complications in the women that you treat? Real question. Do you treat white women the same way you treat Black women when it comes to referrals for mental health treatment? Are you even asking, are they okay? I know that there's this strong Black woman stigma that exists. Every woman should be asked, are you okay? Are you struggling with anything? Do you need some help? Do you need assistance? There's no need to automatically have that thought process like, oh no, they okay, I don't even need to ask them. Or if you do ask them, being willing to understand what it is they may say is happening with them, and how do you react to that? That's a big part of it. How do you react when they do actually present and ask you for assistance? Your reaction should be proactive, like, oh, let me help you. It's certainly, going back to the other side, shouldn't make the woman feel like, I really can't talk to this provider because they may take what I say the wrong way, or they may be not listening to me and what I'm saying, or not even being asked. Because a lot of on our intake forms that we ask women, hey, did anybody talk to you about maternal mental health since you had your baby? They're like, no. I mean, in what way? Like what give me some examples. And so we give examples, and it's like, no, that certainly was not a part of my conversation. That's what's missing. That's a key component when we talk about maternal mental health in our community. That's what's missing. We're not even being asked, are we okay? That's the first thought. Like, that's simple. Hey, are you okay? How are things going? And then when we give a response, not to say that you have to be wholeheartedly prepared for what the response is, because it may unlock and open up a big door, but you have to be, again, proactive and ready to jump in. If they are telling you that they need help, you need to help them. But you also need to make them feel comfortable enough to ask. The next one says, do you address the cultural differences in a woman that you treat before you refer? So let's just say you are screening and you are doing the referral. Are you being selective? Are you making it a right fit? Because I feel like if you take the time to refer, you want to make sure that this woman is getting the help that she needs. Are you doing a proper screening of who you are referring? Now, remember, I said I do want you to ask if someone needs help, but if you're going to take the initiative, which should be automatic, but if you're going to do it, you need to do it full circle. You need to make sure that you're referring these women to someone who will really understand them culturally, understand who they are, understand their circumstances, full circle. Making sure that you are referring them to someone that will, one, help them, and they will want to receive that help. Those things are important. We just don't want to just say, oh, well, you're presenting this way, let me just refer you over to somebody, I heard they do maternal mental health care. No, we need to do screening of the persons that we are referring out to. And then the last one, which I feel is very important because it is how I came into this work. Are you addressing maternal mental health complications in women who have experienced infant loss? And the reason why I bring that up is because when we are, I know it's a lot. And as fast as I am talking, you'll have to genuinely just kind of take it in. but addressing everybody in their birth story. So any woman who gives birth can experience a maternal mental health complication. It's not just the women who present with a live birth. It's more than that. It's bigger than that. And so what I am asking for every one of y'all that are listening to me talk about this is to be inclusive. Like, don't automatically believe when a woman has experienced a loss, and that loss also includes miscarriages. We are also talking about abortion. Any woman who is giving birth can experience a maternal mental health complication. Ask these questions. Be thorough about it. Even a woman who may present with a live birth, she could still be struggling with her emotions from a previous birth that resulted in a loss, or ended in a miscarriage. All of these things are factors. So if we get it in our mindset that all birth stories matter, they do. Any woman that's giving birth should be included in the maternal mental health spectrum, because other than that, there's this delay in getting the help that they need. This is a real thing, and it happens. And so for me, looking at the maternal mental health list, it has to be inclusive of all of our birth stories. But when we put Black in front of maternal mental health, it is because Black women right now are a population of women who are not being served. And that's important that we keep saying, like, hey, like, do a little bit more. It should be automatic, but I have to say it in those terms. Do a little bit more and dig a little bit deeper, and don't be afraid to ask somebody how they doing. Just simple, just like that. How are we doing? What can we do? How can I help you? That's like, I know sometimes it sounds simple, but it is just that simple to look for a great referral. Actually build your own referral resource list. So then you've already done the work, and you've already vetted your resource list. You can refer out. But stepping into this maternal mental health space, we have to do more. It is beyond important. Here we are in this COVID-19 pandemic. You don't think that these women they're birthed in a different way. And so that's something more. So we've had these issues that existed before this pandemic, and now we're gonna have even more that will present. I've been saying lately that a lot of people are being introduced to their mental health. Never had any complications, no anxiety, and now here we are in a different space, and these things are popping up. So we need to be more aware. We need to start asking women, how are they doing automatically? All women should be asked how they're doing without any stigmas attached to it. Next slide. So for me, it's like next steps, like, what is recovery? I think we need to discuss, like, real short, what recovery is. Like, there's this twofold to recovery. One is to return to a normal state of mind or strength. And then the second meaning is the action or process of regaining possession or control of something lost or stolen. So if we don't address what a person feels like has been lost or stolen, there's no recovery process that happens. There's no, oh, well, you had your baby 3 months ago. You still feeling like this? Well, I didn't get to the recovery process. So yeah, of course, I haven't addressed that I'm feeling like something was taken from me. I haven't felt like I've been in this rebuild mode. I'm not there yet, right? So we don't ever get to this recovery state of mind. But this right here is what that could look like. Breaking the maternal mental health depression cycle. Like, this is a cycle. When we think about it culturally, our moms, our grandmas, our aunts, someone in our family may have experienced a maternal mental health breakdown or a maternal mental health aspect and not even known it, right? So they didn't know it, we didn't know it. It just continued to go on, and no one ever broke that cycle. So these are 3 things that should be at the forefront when we start to really break down this depression cycle. One, we got to increase coping skills and the distress tolerance, learning to deal with issues effectively on a daily basis. That can happen. That's why it's number 1. Those things can happen, but it doesn't happen until you actually ask these women, what is it that you need? The willingness to seek counseling services. We got to make counseling like a thing. If it's not a thing, people don't want it, right? So we got to make counseling a thing. Like, if you need help, it's okay to go to counseling. And what does that look like? And it doesn't look like, and we have to see those of us that look like us saying that this is a thing before we start to believe it. But understanding how effective counseling services can be during the maternal mental health period. So counseling it should be like mandatory, not really optional. You need it. We need it. Decrease stigma associated with maternal mental health. How we do that? Understanding that stigma is a barrier that comes from lack of understanding and has no bearings on who you are, who you hope to be, and to work towards being by seeking treatment. So if you have a maternal mental health complication, it doesn't consume you. It doesn't make, you're not that condition. So you're not postpartum depression. You're not postpartum anxiety. You are who you are, and you need help, right? And so that's a stigma that needs to be broken in this space as well. But if we're doing this to break up this cycle, I'm telling you, we will change the way maternal mental health currently looks. Next slide. So as I work towards wrapping this up, how can we move forward? Cultural competency and really understanding what that looks like, and that is not just a word. You need to understand if the bigger, larger population of people that you serve is African American, Black, Hispanic, Indian, women of color, if that's your population, you need to understand cultural competency. That's very, very important. And again, to reiterate that all birth stories will never be the same, but our birth story outcomes need to be acknowledged. Like, full circle, if we are inclusive in this thing, I feel like we can really, truly combat maternal mental health. And that comes from a place of being someone who experienced infant loss and struggling to find somebody talking about it in that aspect, and then somebody talking about this feeling that I was feeling that did have absolutely nothing necessarily to do with the loss of the baby, just the fact that I gave birth, and then understanding later, so far down the line, that it was postpartum depression, and then starting this delayed healing. So if we start to collectively address this thing in a bigger manner, we will certainly make some changes in how we look at Black maternal mental health. Next slide. So I'm going to end with success is walking this journey together. I am here. I have made this commitment to not go anywhere until I really, really see effective change. And that could be 50 years from now. As long as I have breath, I will be here doing this work, working towards making these type of changes that need to happen in this maternal mental health space. Next slide. And so tell your story, speak up, say something. If you're sharing your story and you're saying something, you never know. I promise you, just by sharing, you will save somebody's life. Whether you truly wholeheartedly believe that, let me tell you, sharing your story, speaking up will certainly change somebody who overhears or is directly in front of you. It will certainly save their lives. Again, thank you, BMMA, for allowing me to come into this space today and do this presentation.
Thank you so very much, Kay Matthews. We really do appreciate you for sharing those powerful words and for your work and expertise in the area of Black maternal mental health. It's also important for me to mention to the audience that Kay Matthews is also a board member of the Black Mamas Matter Alliance. And so we definitely appreciate her perspective on maternal mental health and bringing that perspective to the work that we do. Thank you so very much.
Thank you.
Thank you. Our next speaker is Ebony Taylor. Ebony Taylor is the Michigan Executive Director of Mothering Justice. In this position, Ebony manages the Mama's Agenda, acts as Chief of Staff, and co-creates Mothering Justice Strategic Plan. Prior to this position, Ebony co-wrote the Economic Justice Alliance of Michigan's 2017-2018 public policy manual, and worked as a public policy fellow at the Skillman Foundation in Detroit, where she managed special public policy projects affecting neighborhoods and children. Ebony has her bachelor's and master's degree from the University of Michigan, Ann Arbor. We welcome Ebony.
Hello, everyone, and thank you so much, Angela, and thank you, BMMA, for hosting these absolutely wonderful webinars. I'm so excited to be joining you all. This is my first BMMA webinar, so super excited. And I am just going to jump right in. And Kay, absolutely inspirational presentation. Love the work that you're doing, and just thank you for sharing all of what you did. Absolutely beautiful work, and it's so needed, and it's a topic that we don't lift up enough. So thank you. So Mothering Justice is dedicated to returning decision-making power to the ones affected by these decisions the most. The overall goal of this organization is to empower a well-organized group of mothers that can engage fellow mothers and lawmakers around a variety of issues that affect working families. By empowering mothers, I'm sure we can all agree, to influence policy on behalf of themselves and their families, Mothering Justice hopes to change the future of families in Michigan and around this country for the better. For too long, we have seen that mothers have been defined by others, but as a group, we are constantly left out of the conversation. So often women with children have to rely on others' judgment on issues of financial security. When women with children are not able to advocate for solutions to the problems they care about, a vital voice is missing. And through advocacy, leadership development, voter empowerment, and promoting family-friendly advocacy, we hope to raise the voices of mothers and help them become policymakers and shapers. And so super quickly, I'll just run through our 4 pillars. So voter engagement, the goal is always to use economic fairness issues to increase voter enthusiasm and to create momentum around elections. Leadership development is all about creating a grassroots momentum through our 3 fellowships. We have Mama's University, which is advocacy from a parent's perspective. If you want to get onto your school board or anything of that nature, it's a great fellowship for if you're a bit advanced in the advocacy space, maybe not advanced, but not at the beginner's level. Accountability Academy, formerly White Women's School. Yes, y'all heard me correctly, White Women's School. We've gotten we get a lot of reactions from that, but we ultimately had to recently change the name because we were getting calls thinking that it was like a white supremacy type of thing, and it's nowhere near that. But anyway, the person that leads our Accountability Academy is for white women to learn how to be better advocates and to follow the leadership of Black women. And those 2, so Mama's University and Accountability Academy are both online, and we've had international participation with Accountability Academy. We have country wide participation with Mama's University. And then our 3rd fellowship is the Movement Fellowship, and it's local and in person. So it's here in Michigan, but mamas learn the 101s. So advocacy 101, policy, public policy 101, communications 101, et cetera. So advocacy is just amplifying the voices of mothers. We moved to establish a coalition of organizations focused on civic engagement of mothers of color and create meaningful discussion, spaces for women with children. family friendly activism. Um, Mother Injustice understands that many mothers would love to participate in advocacy efforts, but are unable to because they feel pressure to keep their kids quiet, you know, during a meeting, or to leave whenever their kid is becoming a distraction. So Mother Injustice aims to create child-friendly spaces. So whenever we hold an event, we always have child sitting services that mamas can opt into. We also do our very best to hold other organizations accountable for this when mothers of color are asked to participate. Like, you can't ask us to show up and be present and then not offer space for our children. Next slide. So base building, this is where, I mean, it all begins, where we truly do center Black women and at Mother Injustice, women of color in some instances for sure. So we have one-on-ones, and our organizers go out into the community. They meet mamas at events, they meet mamas at the grocery store, and our organizing team follows up with them to have these one-on-one conversations. They're always, you know, at like a coffee shop. We have like a Black, one of our favorite spots is a Black owned, woman owned bakery in Detroit. And so that's always like a reason to stock up on cupcakes and stuff. But so we meet up with moms and have these one-on-ones, just have these one-on-one discussions. This is where we start the process of turning the venting and the frustration into empowerment around the issues that they face day to day. Our mama conversations are basically like a larger version of the one-on-ones where mamas create. So if I meet, you know, Kay at the supermarket, we have a one-on-one, and I say, Kay, do you have any other friends who are frustrated about not being able to find affordable childcare, or not having any paid sick days, or, you know, you just had your baby, you know, 2 weeks ago and you have to go back to work in a week or 2 weeks. Do you have any other friends like that? Can we like all get together and talk through it together? So it's a larger but still intimate space of 5 to 10 mamas who might be facing similar issues. And these mama conversations are held, for instance, in this example, it will be held at Kay's house. It will be potluck style. It's very like family friendly. As I mentioned before, everyone would bring a dish, and we would really like suss out more of these nuances around these economic issues that, you know, mamas really do feel disempowered around. They just feel like that's just what it is, and there's nothing more that they can do. Our community conversations are similar in a sense of, you know, maybe some mamas don't want to open up their home, or they're just not there yet to open up their home to have a mama conversation. We have community conversations in our office in Detroit, and our organizers, let me tell y'all, come up with some very they come up with very unique topics. So it's all about creating a space where we can talk about policy in a comfy environment that's not uptight, and it's of course family friendly. I'll say family friendly at least 50 more times, but and it's just very interesting the difference when in my former role as policy director, I would say, hey, policy this, policy that, let's talk about policy, and it'll be crickets and nobody will show up. But then when you say, okay, come to Mommy and Me Yoga, that's the picture that you all see. You know, mamas show up, they bring their children. We can talk about the issues further. We can talk about what's happening at the legislative level, where we're seeing some momentum around childcare, or some momentum around paid sick days, or some momentum around paid family leave. Another one that always makes me chuckle is probably the last one we had before this COVID crisis was braids and spades, where, you know, braids, as a Black woman, you better know how to brace, you know how to braid some hair, and you better know how to play spades. But we found that, you know, quite a few mamas didn't know how to do it. So we had a community conversation called Braids and Spades. And again, mamas came out, we talked about the issues, and they had a good time, and it was a comfy environment. Next slide, please. So our mama's agenda, this is, I just love this. I love our mama's agenda because we can literally say that it's been curated by our mamas, by our mom, those one-on-ones I talked about, those mama conversations, the community conversations, the mama's agenda booklet that you see to your right has been made up by the community. They have come about through the conversations we've had. The four that we are highlighting, that we're laser focused on right now, are safety net, Black maternal health, childcare, and paid family leave. So under safety net, we we definitely follow all the momentum around Medicaid and SNAP right now in Michigan. You know, we still have to check in on that, but there were work requirements enacted as of January 1st, 2020, where you had to meet certain criteria or certain hours, working hours or volunteer hours to get Medicaid and to get SNAP. We're also looking at, excuse my typo there, oh my gosh. But we're also looking at EITC and graduated income tax as a means of income stability. So, you know, those are two big pieces that come out of safety net right now within our agenda. The next one is Black maternal health through, you know, partners like BMMA and, you know, Black Mothers Breastfeeding Association, definitely lifting this up, definitely looking for solutions, listening to mamas around what they would love to see, you know, as a solution in this area. The other piece is maternal incarceration, something that prior to my time at Mother and Justice, it wasn't, and it breaks my heart to say this, but I wasn't paying attention to it. And the more and more I learned, it just the tears just were flowing, because our mamas behind bars are people too. And I shouldn't even have to formulate that sentence, but they're people too. And to have to deliver or labor or even have checkups cuffed with a guard, an armed guard, who's usually a male, to labor cuffed in handcuffs to the bed, to deliver your child and not have the opportunity to do skin to skin or to nurse immediately because you're being then chained again. We've worked very closely with our legislators here in Michigan, and I'll talk more about that toward the end, but to lift up this issue and to make moves around it. Childcare, access to affordable childcare, quality childcare, is, you know, Michigan's subsidy program is very limited. And so that's one thing that we hope to change. And, you know, as it says there, more families, we want more families to be able to access it. Paid family leave, expanding FMLA, and also really lifting up maternity leave as a need and not as like, oh yeah, I have these weeks off. Like that's the narrative, like around maternity leave, like it's a vacation, and it is, as I'm sure most of y'all know, nowhere near. So next slide, please. So relational organizing, and this is like the hot term or hot terms right now, but you know, Mother and Justice has been doing, just like I'm sure y'all have too, been doing relational organizing for a while, which is just like activating your personal networks. I love our Mom of This program. It allows moms to create their own voter engagement program. So in 2018, around the 2018 election, we got 50 mamas, and we brought them on. They signed contracts. They talked. We talked to them about what we're trying to accomplish, and you know, they were excited. They were activated, and so the idea behind it is that they activated their personal networks. They made lists of 75, each of them made a list of 75 women. Some even made list of 100 women. And we had 3 points of contact that we wanted them to make. 2 were phone contacts, and 1 was a handwritten personal postcard that they sent out, encouraging mamas to get out the vote. We stipend off all of, we stipend these 50 mamas $300. We gave them 100 at the beginning and paid the balance to them once they sent out their last postcard at the end of the program. In 2020, so right now, we are in the middle of a census version of that, where sort of the same idea is there, where we have census pledge cards. We have these mamas who are reaching out to their networks, encouraging them to fill out the census, and then they're following up with them to make sure that not only that they're filling out the census, but that they're reaching out to their networks to do it as well. Next slide, please. Thank you. State of the mama. So there we have 3 big staple core advocacy pieces. One of them is the state of the mama. We have these purple bracelets, as you see the squad here. We do the state of the mama around our Michigan State of the State address and the State of the Union. So what we do is we go up to Lansing, Michigan's capital. We take our bracelets, we take our mamas' agendas, and most importantly, we take our mamas. We go around to all the legislators, even the GOP, and we say, hey, here's our mama's agenda. Here's our bracelet. Do you stand with us around these issues? And can we count on your support around these issues? And then can you wear, so the squad actually wore those bracelets. I think this sounds so bad, but we ran out. I think only 2 of them were able to wear them, but we asked them to wear the bracelet during the State of the State or the State of the Union. And we also asked them to live tweet if any of our mama's agenda issues come up. Next slide, please. So the Mama's March, another big one. We go to Lansing and we do drop-in legislative visits. Again, visiting all of the state reps and senators. We tell them about the Mama's agenda. We tell them about the solutions that we think should be around these issues. One interesting story is this picture here. My mother is actually right behind me. I was 8 months pregnant. And she was totally tripping the whole time. Why are we 2 hours away from home? You 8 months pregnant, and here's the baby right now making noises. Baby, go back with daddy, okay? So we could you get him? Sorry, y'all. Um, so we went into a legislator's office, and she was like, this was a GOP office, and she said, she was like, oh, y'all are just, y'all want state support so somebody can take care of y'all kids. She was like, me and my husband, we took care of our own kids. Y'all are just out here having babies. And when I tell y'all, my mama went off, okay? She went off. And so, that's what we do for the Mamas March. And we also hear from our mama champions too. And we also hear from our state legislators who are our champions at the legislative level. Next slide, please. So our Mama Summit, we had one in August of 2019. That one was really unique. We usually have just like some really just good sessions. We might do like a policy one-on-one or a comms one-on-one. We might do that as far as our sessions are concerned, but in this past one, we actually combined our policy dinners, which are basically opportunities for mamas to vote on the solutions that they want to see. So, and so one of the pictures you'll see there is our issue ballot, and it was the maternal justice one. So mamas literally had the opportunity to hear from the organizer who was holding that issue, and they were able to hear the proposed solutions and then vote on which solution they would like to see. So that one was really unique, and that has really propelled us into the solutions that we're now working on with the 4 issues that I've mentioned previously. Next slide. So this year in 2020, we led one of the largest, I want to say the largest, but I'm kind of scared to say that because I'm just not sure, but one of the largest polls on Black women voters in Michigan. We did that in partnership with the National Women's Law Center. It should be on our website, but it's definitely something about it on our Facebook page. The Caregivers Bill of Rights is what that title started off as 2 years ago when we started drafting this bill. That is not the name of it. It's just what I like to still, affectionately call it, if you will. But we introduced 2 bills, Michigan Senate Bills 830 and 831, the Pregnancy Standards of Care and Community Advisory Oversight Committee bill. And that was just introduced mid-March of this year. Really excited about that, really hoping to see some traction with that. And honestly, see pregnant women we don't want them to be imprisoned at all. But if they unfortunately are, definitely want to see those changes around shackling and around care. So as we all know, Black Maternal Health Week is ending, unfortunately, tomorrow. And we did a matchmaking, we matched mamas with birth workers. The goal was to, especially during COVID, of course, this COVID-19 crisis, we wanted to match mamas with a doula. We wanted the doula to talk with them about their options, whether it's a birth plan, if they say, you know what, I do want to just head to the hospital. Okay, well, the doula would then say, okay, well, let's talk about your birth plan. The doulas are also talking to mamas around like potentially doing a home birth and what that might look like too. And we're offering at least one conversation free of charge to mamas. So all week they've been able to sign on to this form, a form that we have. It's on our Facebook as well, a form that we have saying what their needs are and having the ability to get that help during this very kind of crazy time. Paid family leave. We have again, working with our legislative champions, we have a paid family leave bill that is supposed to be introduced in May, but because of COVID-19, we're still not sure. But it's basically an extension of FMLA. It gives more time to moms, gives more time to care for a family member, and it's mimicked after the Families Act at the federal level. And last slide is just thank you. And these are the ways that we can be reached. And again, it's been a pleasure. It's been a pleasure speaking with y'all. Thank you.
Thank you so very much for that informative presentation, Ebony. We really do appreciate it. And we appreciate all the work that Mothering Justice is doing. Our next presenter is Kadada Green. Kadada is the founding executive director of Black Mothers Breastfeeding Association. She purposefully uses her platform to reduce racial inequities in breastfeeding support for Black families. Ms. Green's innovations in the field are immense. She is responsible for spearheading the formation of the Black Breastfeeding Caucus and co-creating both Mommy-Friendly Detroit and Black Breastfeeding Week. Ms. Green has attracted worldwide audiences with presentations for both Gold, Learning, and iLactation. Her work has been published internationally in Breastfeeding Magazine, the official journal of the Academy of Breastfeeding Medicine. We welcome Kadada.
Good afternoon or good morning, depending on where you are. Thank you so much, Angela. And thank you, Black Mamas Matter Alliance, for inviting me to participate in such a dynamic panel. I'm really excited to be amongst such esteemed panelists, and I'm happy to follow Ebony. We are in Michigan with Mothering Justice. In fact, we're centered in Detroit, Michigan, and it has been a pleasure to work with Mothering Justice over the past years. And when Ebony says that they focus on amplifying the voices of Black mothers, I can definitely attest to that, because we have learned so much from them as they have actually worked to amplify the voices of Black Mothers Breastfeeding Association. So I'm happy to follow you, Ebony. I'm going to talk to you guys a little bit about the work that Black Mothers Breastfeeding Association does to really center Black mamas. Next slide, please. Our mission is to reduce racial inequities in breastfeeding support for Black families. And we do this by optimizing the first food experience through direct service, through advocacy and social movement, and through education and training. And I will walk you through some of the examples that we have around that. Next slide, please. One way that we definitely really center Black mamas is through images and through pictures. And one thing that I encourage people in practice to do is to really do a scan of what your photo catalog looks like when we're targeting, and we make it, we're really intentional about how we target our audience, which is Black mothers. And we want to make sure that we have photos that actually represent Black mothers who are breastfeeding. And so what you're looking at is a photo shoot that we were grateful to be a part of through the W.K. Kellogg Foundation. And what we were charged with was really what are the life experiences of Black mothers who breastfeed. And so we had the opportunity to focus on a few scenes, but what we wanted to do is we wanted to be very clear about the representation of Black mothers, their variety of ages of Black mothers who breastfeed, the variety of the baby's ages, so from infancy to toddler, the sizes of Black mothers, and what that looks like, as well as, excuse me, you want to be focused on different hues that we come in. So we were really intentional about what we select, who we asked, and what we focused on for these particular photo shoots. And so you can see kind of up in the top, Victoria and baby Addie. Tyler Addie. That's a child care scene that we did. And beside her in the center is really, that's a restaurant scene. There are more photos to go along with this. And then we looked at the home, which is on the right. And we also have to keep in mind that Black mamas are busy. And so we need to talk about what breastfeeding looks like when you're doing public transportation. And also we care about what we look like. So we wanna make sure that our hair is laid and slayed. So what does that really look like for a Black mama who has a baby? And also we are working moms. And so that's what we wanted to portray in this scene. I think after it was done and I took time and stepped back, I would definitely want to add faith-based pictures of mothers who are breastfeeding, and also Black mothers who are pumping and breastfeeding. So really take a scan of what your photo collage or your photo catalog looks like, because those things are really important as we center Black mamas and their ages and their lifestyles and what it means and what it looks like for Black mamas to be breastfeeding. Next slide, please. So one of the things that we do in our work, we're happy to replicate Health Connect One's community-based doula program, and we have been replicating their model since 2013 or 2014, I believe. And we are actually a nationally accredited program through Health Connect One, and we're also a licensed proprietary school for community-based doula training here in Detroit. And really what our program looks like is that we take mothers in while they're pregnant, and we provide them with care and home visits and doctor visits and birth plans and all the things that are involved with that earlier on in the pregnancy, all the way up to birth. And when mothers are birthing, our community-based doulas, shout out to Ashley and Robina, who are our community-based doulas now. When our mothers are birthing, we're there with them through the labor and up to the first feeding. We want to make sure that we're there to support our families during their feeding and early postpartum. So we provide care in the home to moms early postpartum. We support them with newborn care, with postpartum concerns, and things like that. And here's one of our promotions on the left side. And you notice it says pregnant, afraid of being alone during your labor and delivery. And then it really talks about a community-based doula and what our community-based doula services provide. Because we have to keep in mind that not all women are familiar with the term of community-based doulas. And it is true, unfortunately, that sometimes our community-based doulas are the only support partner with the family, with the mother when she's laboring. That's not the majority of the time, but that has occurred, and we want to make sure that we're available to not just Black women, but also the most marginalized Black women. In our care, we've had mothers who are in homeless shelters. We have mothers who are sex workers, and we want to make sure that we really embrace that and that we honor them as Black women who are birthing. So that's very important to us and to the work that we do. Next slide. So our signature work is Black Mothers Breastfeeding Club. Black Mothers Breastfeeding Club has been running without interruption since 2008. And when I say running without interruption, I literally mean that we've been having consistent breastfeeding clubs since 2008. They range from sometimes, at one point they were monthly, then they were weekly, then they're every 2 weeks. Sometimes it depends on funding, but they've been a minimum of monthly for years. And so we're really excited about that. And I want to mention that I'm sharing a variety of flyers here because we put out different flyers, but one thing that's important to us when we putting out our flyers is that we are able to connect with people emotionally who we're trying to reach. So sometimes that's through a picture. Sometimes it's through a message that's on the picture, but we want to make sure that we're really strategic about how we engage people. So one thing that we found is very important to our families is a meal. So when we have our Black Mothers Breastfeeding Club, we do not provide snacks, we provide meals, and we have been consistent about that for years. I mean, it's really important that when you have a space that's community centered and that's open for conversation and for dialogue, and folks who are spending their evening with you, if I can spend my time with you for 2 hours and then I have to go home and prepare a meal for my family, then it causes me concern. Like I may have to decide, do I want to go to this meeting today? And often there's food left over, so our families take the food with them. And so if you have someone at home who wasn't present, then take the meal with you. I mean, we're happy to do that. We also make sure that folks understand, that our mothers understand that this is an opportunity for the family to be a part of it. We encourage them to bring their partners. We encourage them to bring grandmas, because we understand that when you get home and you're breastfeeding, once you leave the hospital, if the hospital supported you in breastfeeding, there's that gap or void in support that sometimes happens. And we want to make sure that we have the support of the family. And so our Black Mothers Breastfeeding Club is not just for breastfeeding people. In fact, we prefer that folks begin our club when they're pregnant. And as you can see, it's not always about breastfeeding. The photo on the left, we had a pop-up breastfeeding club, and it was a head wrap party. So the topics are of the topics that are of interest to Black mothers, and then breastfeeding is incorporated into that, of course. And just as Ebony said earlier, we want babies there. We want our families there. We actually keep the children centered in the space that we're in. It's very important for us to do that because we want breastfeeding to become normalized, so that it's not something that's shunned upon. That's shunned upon. We want folks to be a part of it and recognize this as a normal part of the feeding process. And so what you have there is really just a variety of things, but I do want to point out a few things that's important here, in addition to the emotional connection, making sure that you're very targeted in your approach for who you're connecting with. I think there are some things that are really, really key, particularly because flyers travel distances now. It's not just, these don't just somehow stay in Detroit. So we want to make sure that the city's on there, make sure that you have the dates on there, who's welcome. One important thing that I tell people about our Black Mothers Breastfeeding Club is you don't have to register in advance. Now, y'all know Black folks, few of us RSVP, so, right? So if you make someone have to RSVP to attend your club, then you're creating a barrier because it's not necessarily the cultural norm. So we really ask that you just drop in. I mean, we've been doing it long enough. We know kind of how much to expect, how many people to expect, how much to prepare for, but there's definitely that cultural nuance of making someone have to RSVP in advance. We want to remove barriers when we can do that. So there's sometimes when we're trying out something new and we're not quite sure, when we have a breastfeeding pop-up, we might ask people to say, hey, you want to text yes if you're coming, but that is just to give us an idea. It's in no way saying that folks have to RSVP to be a part of the Black Mothers Breastfeeding Club. Next slide. So I told you that we have been running without interruption since 2008. Well, guess what? COVID-19 came. And COVID-19 has really, really interrupted everyone's life. What's happening is really unimaginable. It's taken a huge emotional toll on the way that we function daily. the way that we execute programs. And with that happening, we did not and do not want to forget about our families, right? We realize that sometimes breastfeeding decisions are made in a moment's notice. Like someone can say, hey, I want formula now. And we don't want that to happen, because breastfeeding is actually the most reliable infant feeding choice during an emergency. And so we want to make sure that we are there for our families, and that they understand that if you're pregnant, you want to have something that's easily accessible and there for you. So I really urge you all, if you have families that are pregnant, that you really, really encourage them to breastfeed, particularly now more than ever. Because as we're running out of tissue, folks are running out of stock of infant formula, and we want to make sure that we continue to provide the most healthiest nutrient, the most accessible form of feeding that we can, particularly during COVID-19 and this pandemic. So what we've had to do is we've transitioned our Black Mothers Breastfeeding Club to a Google Hangout. We've been doing it for a couple weeks now. Families seem to love it. I mean, they're really excited about being a part of the Google Hangout, because we're home. We're safe at home. Many of us are safe at home, not all of us. I want to be clear about that. But it's an opportunity to have adult interaction, to talk to your sisters, to be involved with people who are in similar situations as you. So this is kind of our club. We want to make sure we continue to embrace our Detroit families, and that's why this one's kind of specific for Detroit. However, there are other breastfeeding clubs that are happening if you want to do so and attend electronically on a national basis. Next slide. Last year, we had the opportunity to partner with Make the Breast Pump Not Suck and bring the Detroit Birth and Breastfeeding Hackathon to our families. And this was really huge for us. It's important because what this does is, what we wanted to do is to make it known and clear that Black mamas have the solutions to our infant mortality concerns, to our maternal mortality concerns. And often when people are creating high-tech innovations, sometimes they're creating those for us without us. And so that's what we wanted this to be. This is a community-driven, solution-led, high-tech innovation to improve health outcomes, to improve birth outcomes for Black families. And so what we were able to do was connect mothers who have real lived experiences with high-tech innovators. And from that, people pitched app ideas, they pitched ideas for car seat improvements, they pitched ideas for birth centers, and ideas for kits that Black mothers can have when they leave the hospital. The purpose really is to really show that we are the ones with the solutions to our problems, and when given the opportunity, those solutions can happen. So we were really excited to bring the Detroit Birth and Breastfeeding Hackathon to Detroit, and we're happy for our partners to do that. Next slide, please. As Angela said during the introduction, Black Mothers Breastfeeding Association is the anchor organization for the Black Breastfeeding Caucus. While the slide is up, if you're interested in the Black Breastfeeding Caucus, Jade's email is down there. But the Black Breastfeeding Caucus is a national caucus. It's a national collective of service providers, advocates, academics, and other stakeholders who are committed to equitable breastfeeding support for Black families. The mission of the caucus is to mobilize families, communities, and public and private institutions to create strategies, make decisions, and implement action steps that result in equitable breastfeeding support for Black families. What we've recently done is so that we can better activate the members of the Black Caucus is that we've separated into 5 committees, and those committees are family and community, direct service, communications, advocacy, and research. And we feel like these are the committees that we need to really have an impact and to move our mission forward. If you are interested in joining the Black Caucus, you have to be Black. That's the number one thing. And you really have to be intentional about working on behalf of the community. And our mission, moving our mission forward. It is a volunteer caucus. What I encourage some of our caucus members to do, and many have been successful, is sometimes they're able to have your employer make it part of your work time. So that's how we've been able to kind of move forward right now. If you're interested in joining the committees, you can contact Jade, or you can go to our website, blackmothersbreastfeeding.org, BMBFA.org, and I think it's /BBC. But check it out. There's more information. We invite you all to join. Next slide. So we are, when I say we, the leadership of Black Breastfeeding Week, which includes myself, Kimberly Seals Allers, and Anaya Shangadole Ayoka, we are in the planning of Black Breastfeeding Week. This is, I think, our 8th annual Black Breastfeeding Week, which is celebrated every year from the days of August 25th through August 31st. And one thing that we really do is center Black mamas and Black babies. And on the right there, you see a picture of the baby lift. We ask that folks who are participating in community events around the nation have an annual baby lift. And what we try to do is nationally coordinate the time. We know it doesn't always happen that way, but we really try to nationally coordinate the times so that we're all lifting up our Black babies to the highest pinnacle around the nation. The last 2 years, we've had over 110 community events throughout the nation. The best way to stay up to date with Black Breastfeeding Week is on our Facebook page. So if you are on Facebook, follow us at Black Breastfeeding on Black. All you have to do is put Black Breastfeeding Week in there, and that's where we make our updates. That's where our most recent updates are placed. We also have a website, and I encourage you to follow us on Black Breastfeeding Week on Facebook. Next slide. So I am part of the inaugural class of the W.K. Kellogg Community Leadership Network Fellowship. And part of that work, my colleagues Jay Clement and Valerie Jiggets, we created Mommy Friendly Detroit, which really it's a framework about honoring Black motherhood. And I just want to put, without going into details about Mommy Friendly Detroit, I think the messaging here is important. And so I'm going to actually start with the one on the right? So it says, being mommy friendly means that women are recognized partners in their healthcare. Women are acknowledged as dynamic, though imperfect, that mutual respect is a desired outcome, that healthy babies are a direct result of healthy mothers, and that there is dignity and honor inherent in motherhood for all women. That's powerful. And it's a lot. And sometimes people say, how do you do that? Like, what does honoring Black motherhood look like? Well, it's actually something that's tangible. We can honor Black motherhood through our policies. We can honor Black motherhood through our practices, and we can honor Black motherhood through our attitudes. This is not something that's just an idea. this should be represented in the way that you move forward in your work. So let's start thinking of honoring Black motherhood as something that's very tangible, because it is. There are measurements that you can put in place for accountability. And folks who are serving us, they need to be accountable to us. And that's why it's important that we make sure people understand that there's really dignity and honor inherent in that. And on the left, it says that it is a direct, and this is, I want to, Mommy Friendly Detroit is really the brainchild of Jay Clement, and I'm happy to be along for the ride and really help her bring her vision to life. But Mommy Friendly Detroit what we're saying is, it is a direct disruption of racism to celebrate and honor Black motherhood. I had to let that sink in, but I'm going to repeat it again because it's so much in that statement. It is a direct disruption of racism to celebrate and honor Black motherhood. If you are celebrating and honoring Black motherhood, please applaud yourself, pat yourself on the back. This is not easy work that we're doing. This is very difficult work. It takes a toll on us physically. It takes a toll on us mentally, because most of us who are in this work, we're connected to it. We're deeply connected to it. We're entrenched in it. It's personal. We might try to put a barrier up at times and try to separate it, but it's really personal to us because we take it seriously. And one thing that we do at Black Mothers Breastfeeding Association and for Black Breastfeeding Week is that we come from an asset-based approach. We're always looking at what we're doing that is helpful to mothers, and we build on that. And that's what we want to keep doing. That's why those words celebrate and honor are really critical to what we're doing. So I'm really thankful for you all being here. I have one more slide. I want to invite you to continue to honor and celebrate Black motherhood with me. We have our annual conference coming up. It was the Motown Experience Birth and Breastfeeding Caucus. We had to pivot because of COVID-19. And so my team and I, we've been really working hard to make that transition from an in-person experience to a virtual experience. We have a host of wonderful presenters who are going to be a part of our online conference. We have Dr. Angela Johnson from the University of Michigan. We have great presenters. If you're not following us on Instagram, please do. It's BMBFA. And we have all our presenters there, our community-based doulas. Robina and Ashley are there. We have Representatives Leslie Welch from Birth Detroit. We have the amazing Kimberly Seals-Allers, Nikia Sankofa from United States Breastfeeding Coalition, Dr. Michael Young from Howard University. This is an amazing opportunity, and that's not all. We also have Miss Black USA, who is a part of our conference. So this is an amazing opportunity to continue the work and continue to learn and build on the repertoire of knowledge that you have, and the impact that we have and our responsibility to Black mamas and Black babies. You can find more information on our website, bmbfa.org/conference. Thank you so much for this opportunity, Angela.
Thank you so much for that great presentation, Kidada. And yes, the personal is political, especially for us Black women. And this is why we do the work that we do, even here at BMMA as well. Thank you so much, Kidada. Our next speaker and also our last presenter for today's webinar is Tanae Harris. Tanae Harris is the founder and creative director of Mommy Up, an online and local meetup space that seeks to empower mothers to flourish. After years of working for some of the country's leading nonprofits and faith-based organizations dealing with civil and human rights, Tanae found herself in a new realm as a mother. She believes in the importance of working with and empowering mothers and believes that strengthening mothers creates more sustainable communities. Welcome, Tanae.
Hey everyone, thank you so much, Angela, and to Black Mamas Matter Alliance and to the rest of the panelists. I am very, very much grateful to be here with you all today as we're talking about centering Black mamas in practice. And so when I think about the work that we need to do, or the work that I believe that is very, very powerful and central to when we're thinking about centering Black mamas in the Black community and Black folks in general, I center liberation. And so I'm before you today to really talk about, or maybe more so give some, or provide some tools and reflections as we think through how we can truly center Black mamas in practice. So in 2016, I founded and started Mamas and Mimosas, which was an opportunity for us to be able to really come together and build real intentional community with other moms. And so for us, it was about, if we provide space and place for us just to be able to come together and be our true and authentic selves, how does that manifest into larger conversations that we can get into, from advocacy to thinking about our parenting, to thinking about sustainable communities, and so on and so forth. And so over the past year, I've had the great pleasure of being a co-founder of the Bloom Collective in Baltimore with Stephanie Etienne and Desiree Israel. And for us, a lot of our work, we deeply center and keep at the forefront of our work liberation and centering Black mamas, Black folks, children, families, and community, and really centering what it means to really thrive. So our gatherings and our experiences are meant to help build deep intentional community, and for us to shift the way in how we enter the work, right? And so when we enter this work, we're entering the work with as being part of a continuum. The work doesn't start or end based upon our entry point into it. We continue as part of this continuum. And for us, we center our work as liberatory relationships, and we see this through coevolution as community connection and collaboration. And for us, it's about deeply listening and asking the right questions and asking, how can we best serve you? Next slide. So I also want to center this quote by Bell Hooks, where it says that the moment we choose to love, we begin to move against domination, against oppression. The moment we choose to love, we begin to move towards freedom and to act in ways that liberate ourselves and others. Next slide. And so here you'll see a few photos of some of the work that we have done, gathering birth workers, Mamas and Mimosas, where we have the opportunity to have most recently Danny McClain, and then also Jamila Banu, who is over Oyen Handmade here in Baltimore City. And just having space and place to be able to talk about the things that are happening, place and space for Black mamas and Black folks just in general to be able to come together and think through and engage and work together. Here you'll also see a photo of our first Bloom Collective cohort. Kadada, you'll be happy about this, where we are working with other Black folks in the greater Baltimore area to center and to uplift more Black and Indigenous folks of color to become certified breastfeeding specialists. And we're doing that with the Maryland Breastfeeding Coalition and also with the lactation education resources. Next slide. Next slide. And so when I was talking about tools, there's a few things that I want us to really think about how we enter into this work and how we do the work that we do. And so I want to talk about historiography and genealogy. And so historiography is the way history is written, who wrote it and why they wrote it and recorded it the way that they did. And so an example of that would be for when we have heard in our history books, that time we were in middle school and high school, and our history books would say that enslaved Africans were illiterate, right? And then we have to ask ourselves the questions, were they? Well, no, they weren't. They weren't illiterate, they just didn't speak English, right? And so it's how we're shifting the language, how we shift the language that's given to us and the ways in how we repeat it back into community that becomes extremely important. And then genealogy is tracing the development. And so, we tend to think that our vision of our ancestors is extremely small. right? And so I know a lot of us, I did it too. We wore that t-shirt, or we said that quote, "I'm my ancestors' wildest dreams." But is our vision so small of our ancestors, where they were the first to do all the things beyond PWIs, beyond white institutions saying that we are great? We must always center that we are great, right? And so how do we keep that alive in all the things that we do? How do we tend to forget the deep well and vast contributions beyond the white gaze, and how that is extremely important to how we think through and how we do this work with great intentionality, right? And so we also have to look at scarcity and abundance. And so we live within a capitalistic society that wants us to be scarce, that wants us to center scarcity, that also wants us to not live in abundance. And where does that come from, right? And so that manifests into hierarchy and oppression, right? Hierarchy and oppression. So it's wherever capitalism, white supremacy, and racism exists, there's always going to be hierarchy and oppression. There's always going to be scarcity and abundance. And that for us, we always, always, always must keep at the forefront that we have to be in co-evolution, and that we always have to be focused on liberation. And so in addition, it's for us to really, really, really deeply center and think about how we must learn and unlearn new ways of being and becoming, right? And so we all have been socialized to uphold white supremacy and racism. We've been conditioned to do it within the society in which we live on, the society in which we live in. And we must do the deep work to decolonize in a very, very deep way to be able to really, really make the high transformative change that's needed. And so we must also center, like when we're talking about decolonizing, how do we do the work to not cause harm? And understanding that this process, it's not a linear path, that it's very cyclical. And so we must continuously do the work that we must do if we're saying that we really want to center Black mamas, if we're saying that we want to center the Black community, and if we're really talking about liberation. We tend to overuse liberation. It kind of gives us our token. We become avatars in this work. But how do we really think about liberation and have the deep imagination to really actualize that in a very real way? Next slide. And so, liberation is a process. And I'll give you, a few things, centering beloved community. And what does it mean to center beloved community? How do we do the work within our own scope when we're thinking about our own locales? What are the gifts, talents, and the genius that already exist? How do we tap into the gifts and the talents that exist? If I'm looking at Baltimore, what are the gifts and the talents that already exist, and how do we uplift it, right? Because there's so much time, talent, and treasure that already exists. And then we always have to cultivate principles, right? And develop framework. So it's beyond personalities. It's beyond the limelight and the celebrities, but it's the everyday work and the everydayness that we must center. Again, we have to be reminded that this work is not a linear path, that this is very cyclical. And so we tend to think like, I did this thing, I took this training, and so I am going to get to this path. This thing is ever going to change, it's ever going to evolve. And so we always have to keep that at the center, and that is interdependent. This isn't about any of us doing this on our own. We would not exist if we always only did this on our own, that it requires us to work collaboratively and do this work in the everyday practice, and deeply understanding that everyone plays a deep role and a part. And so we also must remember and keep at the forefront of our minds is that no one is disposable in this work, nobody. And so because we live in a capitalistic society, we will oftentimes center the fact that someone is disposable, and that we have to always remember that we must always challenge the systems and the structures that have created the outcomes. I can't be upset when I see someone who down the block from me here in the beautiful city of Baltimore, where someone might be addicted to drugs. But I am most upset at the conditions, and I must question the conditions that have created that outcome, and I must fight against that as well. Next slide. And so when we're talking also about reimagining what is possible, Lucille Clifton has said, we cannot create what we cannot imagine. And so we have to take time. We like this moment of us having to sit still in our homes. How are we going to rise to the occasion in this moment? And so us really thinking through how can we do better work when we get to the other side of this than what we had done before. And so I'll center this quote by Adrienne Maree Brown, and it says, I believe it is how communities have survived. I believe it is Harriet Tubman going back to free others because it wasn't enough to free only herself. I believe it is Ubuntu in my life. I believe it is freedom that we are longing for, which that will never be given to us, which we have to create, the pulsing life force of the collective body we are birthing, the rhythm of a shared heart. And so we're thinking about Ubuntu. I am because we are, therefore I am. It centers very, very deeply the high intentionality that we need to be able to do this work, to really center liberation, co-evolution liberation that will really allow us to actualize what is possible for our communities, for our families, and most importantly, our Black mamas. Thank you.
Thank you. Thank you so much, Tanae, for that brilliant and wonderful and uplifting presentation. And thank you to all of our presenters for lending their time and expertise on today's webinar. All presenters will remain on the webinar until the close to answer questions sent through the chat box. But before taking questions from attendees, I'd like to briefly go over some announcements that we have for the rest of Black Maternal Health Week. Please join us tomorrow as we close out Black Maternal Health Week by inviting your friends and our friends to the Natal podcast to take over our Instagram. NATO is a podcast series about birthing while Black in the United States. It was conceived and produced by a team of Black creatives and parents. And we are so thrilled to be a thought partner on this project. Follow along as the NATO producers take over our Instagram account for the day through engaging content with our staff, partners, and families from the podcast series. It is not too late to engage with us for Black Maternal Health Week. Please visit our website at blackmamasmatter.org/BMHW to still look through our toolkit and to also look through some of our member organizations, their local events that are still happening and still going on throughout today and tomorrow and even until the weekend. And as a reminder, all webinars are being recorded and will be available for your viewing on our website. I will now turn it over to Rose Aka-James, our National Membership Manager, who will be fielding questions from the chat box.
Thank you, Angela, and thank you so much to our presenters for their amazing words shared with us today. We'll be taking a few questions from the Q&A box and the chat box. My first question that I see, this can be addressed to Kay. It says, there are many communities that lack mental health providers. I know people who drive 3 hours one way just to see their mental health provider. What is the recommendation for communities with limited access to practitioners?
One, to have the conversations around this. So we don't usually know there's a problem until we know there's a problem, right? So if you're seeing and knowing that someone is having to drive 3 hours away from the community that they live in, do a little bit more investigation into seeing why this is happening. What are the available resources within their own community and what that looks like? Because sometimes there's a reason why we drive 3 hours away. Probably some of the things that I listed in that one slide about barriers. So it's about doing, if you know that this exists, do some research, see what's going on, and then start to address it within your own community. These barriers, these things that we can address, actually start within our own community. So now you know there's a problem, start working and seeing how. And that's talking with the local clinics, seeing what type of resources that they offer that maybe no one even knows about. So it's like basically becoming this grassroots activist, taking things into your own hands when you see a problem. So it's just like a work in progress. But now that you know that there's an issue, you start to work with other organizations that may be in the area doing it, or taking the lead from some of us who are on a national level and seeing what we're doing. Having these conversations is how we start to resolve some of these barriers that exist.
Thank you so much, Kay. Our next question is from an attendee who says, as a father and dad that works with WIC that deals with the fatherhood side of the WIC program, how can I relate this information shared on presentations to the men? Because we need to understand as men what's going on with Black women. And this question can be answered by any of our presenters.
Hi, everybody. This is Ebony. Again, I would say definitely tailor, I'm hoping that this person is still on the webinar, but, you have to tailor it to in the best way that you can deliver the information, but certainly share this, share the webinar with them. As I understand it, this will be made available. It will be made available after we're done here. But I would just say start the conversation. I think that it means a lot. It means a lot for us to hear from men around these issues. I know even with my husband, I'm always like, oh, okay, he's been listening to me when I talk about breastfeeding and when I talk about skin to skin and all of these policy issues. So I just think just starting the conversation, having your facts in line, having the resources ready to go, or a place to point other men to as the conversation progresses. I hope that answers the question, but those are the first things that come to my mind.
Thank you, Ebony. Is there anybody else who'd like to add to that? Okay, we'll move on to our next question. This is from an attendee, and they asked, do any of the panelists have experience or have they explored the possibility of engaging with employers in their work? Are there any employers who have actively centered Black mamas, perhaps through employee resource groups?
Hi, this is Kadada Green from Black Mothers Breastfeeding Association. We have over, I guess, the last year or two, we have really been working with employers to ramp up their interest in having community-based doula programs. So it's part of our workforce development to make sure that employers, like our strategy is for, again, Medicaid, it's for Medicaid reimbursement, it's for employers to value community-based doulas so that they want it to be a part of their strategy and the part of their budget, so that it's not just accessible if it's a grant program, but it's something that you value. And there are other strategies, but we've been working with employers in that way by having employer advisory committees and really figuring out how it is that they can show that they value and honor Black mothers by working to get community-based doulas on their staff.
Thank you, Kadada. Would anyone else want to add to that?
Yeah, so just with our policy work around paid family leave, paid sick days, we've definitely engaged um, employers, employees. I forget which one you mentioned, but definitely engage that community, the business community around that campaign for sure. Um, I can certainly share my information if whomever asked, asked this question needs more detail, but I'm happy to do that. But yes, we have.
Thank you, Ebony. And our last question that we will answer today is somebody asked, what is the general consensus about breastfeeding for COVID-19 positive or persons under investigation, recommending breastfeeding or skin to skin, hand expression only, or are providers recommended that mothers be separated from babies until they get results?
This is Kanata. So we've carefully looked at the World Health Organization and the Center for Disease Control's recommendations. And I again want to make sure that everyone understands that the most reliable form of infant feeding during an emergency or during a crisis is breast milk. So as of now, COVID-19 has not been found in breast milk. So the concerns with breastfeeding a child when the mother is COVID-19 positive are the respiratory concerns. So the recommendations are that that the mother nurses her child and practice respiratory hygiene. And what that means is covering the face, washing hands. So when you're nursing your baby, you're covering your face and you're washing your hands. And so you're keeping those things taken care of. And then there are times that they're also recommending that if you want to be separate from your baby, then you can do that in your room, and maybe there's a drape that goes in between the mother and the baby. We highly recommend that. We want to highlight that the CDC says this is the mother's choice. So just be aware of that when you're delivering and you're in a hospital and decisions are being made for you. So keep those things in mind with families who are delivering. So as of now, breast milk has not been found in, the virus has not been found in breast milk, and the recommendation is for respiratory hygiene when nursing.
Thank you, Kadada. And I'll take one last question because I think this is a question that's been on so many people's minds, especially now. An attendee asks, what advice would you give currently pregnant mothers during COVID-19? And this is open to anyone.
So I'll add that we want to maintain the precautions that we're taking now: social distancing, respiratory hygiene, washing our hands, trying to limit exposure to COVID-19, because as we know, this is evolving. Like, we're learning from day to day. Every time I turn on the news or click on a website, there's something new that researchers are learning about COVID-19. So it's very important that you're as cautious as you can be, and keep practicing those social distancing messages, those social distancing methods, and washing your hands, and trying to limit your exposure to people who may have also been exposed to COVID-19. And I'm really open to anyone else who wants to add to that.
Yeah, I would say ditto, Kadada, and I would just add just continued education in general. Again, mothering justice is matching birth workers to mamas right now. And I think that the deep knowledge that doulas and other birth workers have will only aid in on top of what Kadada just mentioned around washing your hands and following the standard precautions. So moms can weigh their options around, if they're expecting soon, whether they want to birth from home, what they should do if they do have to enter a hospital, so on and so forth.
I would also want to add that make sure you're addressing the anxiety that you may be feeling. So ask your provider the questions you need to ask. Like, don't hold them in. Like, don't go into it mentally strained. Like, address these issues. Bring up your anxiety. Bring up, you may be feeling a little down during this time. Address all of that, because that too is going to play a factor after you give birth. So your mental health is important during this, really, really important during this time to ask those questions.
Thank you to all our presenters. As Angela said, all of our webinars for this week have been recorded and they'll be available on our website after Black Maternal Health Week. As a reminder, we just ask that if you're going to use any content from any webinars from our presenters, that you make sure that you please cite their work, cite any slides that you choose to use. We appreciate you all for joining us today, and I'm going to turn it back over to Angela.
Thank you, Rose, and thank you again to all of our panelists. And thank you all for joining us for this webinar today. And we also want to say a special thank you to every participant who has joined us since Monday on every single one of our webinars. We genuinely appreciate it. Thank you. We hope you gained a new understanding of centering Black mamas to live and thrive in practice by attending this webinar, and will use this knowledge in your daily work to become champions of Black maternal health rights and justice. You can continue to engage with us throughout the Black Maternal Health Week campaign by following us on all of our social media platforms and through the hashtag BMHW20. Visit our website for additional information about BMMA, sign up for our newsletter to be involved in our initiatives, and make sure you support our work. With sincere gratitude for your attendance for today's webinar, we thank you and have a good one.